the third-party payer. There is not a single other thing in life that people do where they don't have to ask, how much does it cost? So, when people are in a situation where they're getting health care, they don't even concern themselves with that. Little story for you. Several years ago, I was at the hospital because our oldest son had been born, and they were asking me if I wanted them to give him a particular kind of immunization. It wasn't one of the immunizations that was required. They were just recommending that we get it done. And I asked the doctor, well, how much does it cost? And he looked at me like he didn't know where I came from. And he said, well, I don't know, but I'm sure your insurance company will cover it. Well, I happen to know that my insurance company wouldn't cover it, so I repeated my question, how much does it cost? It took them at the hospital over 2 hours before they could give me an accurate cost for doing that immunization. Now, there's no other place in town I go where I can't walk in and say, how much does that cost? And they can tell me. The reason they can't tell me here is because of this third-party payer system. Anytime you are getting something done where someone else is paying for it, you're going to get more of it done. It's human nature. And that's one of the biggest elements of this pervasive dynamic upward pressure, because we want it all. Who wouldn't if somebody else is ostensibly paying for it? So that is what you have to change. You have to change it. And the way you have to change it is you have to get rid of the third-party payer. You have to get rid of it. Now, I'm not saying completely get rid of insurance companies or completely get rid of government involvement, although I would be in favor of that one in time. Okay? I'm not so radical right now as to say just stop it altogether. But there's one simple solution to this process, and that is health savings accounts. I know this is not the first time you've heard of them. I know that other people are talking about them. But I want to show you why it's so important. If you would give someone the ability to put a few $1,000s in a health savings account, I think right now it's like $3,000 for an individual or $6,000 for a family, a couple or a family. And that was the money they had to tap into first whenever they were going to get any health care done. And if you increase the incentive for them to save that money by telling them not only could they have that money carry over from one year to the other, but that if at some point in the future, say after 2 years or after 3 years, they wanted to take that money out, they could do it tax-free. Wouldn't that be a great thing? They could do it tax-free. Then that would create an enormous amount of downward pressure on costs. Because the people who were paying for it, at least the initial cost of it, would be asking that all-important question, how much does it cost? And because they would be asking that question, doctors and hospitals would be more keen to be able to answer that question, which would create then more competition between doctors and hospitals. Because if I went to hospital A and I wanted to get an idea of getting surgery done, and I said, how much does it cost? I could then go down the street to the other hospital and say, how much does it cost for you to do it? And I could compare and I could choose, just like I do when I go grocery shopping, or go shopping for clothes, or a car, or anything else. So, what we need to do then is incentivize as much as we possibly can health savings accounts so that it's the patient, not the insurance company and not the government, who is shelling out the money from $1. So you'd have to have major medical coverage, so the insurance companies still have a role, major medical, because people can't put away enough money to cover all the kinds of things that they might have to pay for regarding their health in a given year if some tragedy happens. I understand that. Major medical coverage. But they would still at least have enough skin in the game to, for all other situations, try to save that money as much as possible. And here's where the government comes into play, because you talked about all those people who don't have coverage, right? What if the government said, you know what, we want to help all of you people who are either poor, like now on Medicaid, or aren't covered, But the only way we're going to do it is we will provide you with money to start this health savings account. And then you policy wonks there in Washington can figure out how long a time that people would be able to receive that kind of money until they're up and running on their own. Okay? But the government would have to go on record as saying the only way we're going to help in the support of this system is through this kind of mechanism, so that instead of having all of these arrows going up, we would creating arrows going down. So that there would be pervasive, dynamic, downward pressure. Now, you ask, well, how are we going to do all this? Well, once again, I've looked into the numbers, okay, at roughly $800 or $900 billion that's spent here. And I would say, why not give people a massive tax cut? We need a tax cut anyway for the economy. And now I want to come back to what you said earlier, that until we deal with this health situation, we're not going to be able, until we deal with these enormous costs, we're not going to be able to fix the economy. What a wonderful way to pair these two things together. Create massive tax increases, or tax cuts. Yeah, don't create massive tax increases. Create massive tax cuts for people to make use of this kind of vehicle so that we can create downward pressure instead of upward pressure. Now, what else is going to happen then if you do that? Well, what is going to happen to fraud if people know that by not getting medical services done, they'll be able to save and possibly keep this money? Why would they want to defraud the government when they've already got the money in the bank? You would greatly reduce fraud all throughout the system. You would increase the competition, as I said before, all throughout the system, which would increase the quality of the care even more than it is already in our system, which is the best system, quality-wise, in the world. As I said, this situation has got me going a little crazy because it doesn't seem to me like either the problem or the solution are all that hard to figure out. Now, as I said, you guys have got all the policy guys there in Washington. You've got all your staff and everything. You've got people who know the numbers, all right? Well, set them to work on this situation and get them to crunch the numbers and get it done. Get it done. Because until you go this direction, until you do away with the third-party payer in this system as much as you can, you are going to be fighting a losing battle. And that's not your losing battle, it's ours, because if truth be told, you see, it isn't the insurance companies or the government who are really paying for this. It's the people here. Because when you raise our premiums or raise our taxes, you're doing it to us and we're the ones paying for it. So stop it. Stop it. Let us use the money, our own money first. Incentivize health savings accounts. In every way you can, so incentivize health savings accounts that the whole country would be using them. And the situation will change immediately. Thank you.